My name is Claire McDaniel, and I'm a deputy district attorney here at the office, and I'm a supervisor in our Metro division. We have individual therapy as well as group therapy. We have medication management, referrals for psychiatric services. We have medication assisted treatment. We also have a lot of non traditional therapies, such as equine therapy and even yoga. We also provide access to inpatient treatment for those who need that as well. I have so many stories where people's lives have been changed by just by getting meaningful access to treatment, to behavioral and mental health care. Um, the population that we deal with in Metroport, oftentimes they've never had that kind of access to that kind of health care. So the fact that we're able to provide that has often changed lives. Our programs, I have, there's this one man who he was a Vietnam veteran, and he, of course, had a lot of trauma from being, in combat in Vietnam, and he went through our one of our programs, and he had access to EMDR, which is an intensive trauma therapy. And so he was able to deal with that trauma for the first time, really. I really believe that he is a success story. I think that it really changed his life. There's another gentleman that went through one of our programs in Metroport a couple of years ago, and he had a long rap sheet. Nothing too serious, but it was pretty extensive. And he was an older man, and he, for the first time in his entire life, told the program and his therapists that he had been pretty severely abused as a child, and he had been carrying that trauma throughout his life. And for the first time in his life, he was able to address that and get the kind of care that he needed. I think that it also changed his life. So I have lots and lots of stories. I know that providing meaningful access to mental and behavioral health care and treatment is the absolute best way to reduce recidivism and to increase public safety. Putting people in jail does not do either of those things in a permanent, really meaningful way. But allowing people the opportunity to address the underlying reasons for poor decision making, for these behaviors, so they can actually change those behaviors. It's the best way and really the only way to truly make our community a safer, healthier